Looking for ways to cut costs, work with the administration on health care?
Well, here's the way I look at it. The election's over. No, it's not an answer. I'm responsible for the citizens of our state. I want to focus on what their needs are. I know from a healthcare standpoint, they need lower healthcare costs. They need improved access and improved outcomes. So my goal is, the only way I've ever gotten anything done in life is to sit down with people and see if there's common ground. I got the Everglades settlement done this last year by doing that, and my goal is to do the same thing here. But in the end, I'm responsible for our state. I'm responsible to make sure that our citizens get what they need. So right now, as I said, what I've seen about the state exchange is that I don't know who's going to pay for it. It's going to cost a lot of money. We have tight budgets in our state. Medicaid has already been growing at 3.5 times our general revenue. So I'm already working to make sure that we control the growth rate of Medicaid. So, but I want to sit down with them and see if there's some common ground.
What can they offer you on Medicaid expansion? What do you want? Do you want them to lower it down to 100 or 80%? What can they do to make you say yes?
The biggest thing they can do for us is understand that I care about our citizens. I want to make sure we have the right safety net for our families. Give us more flexibility to make our own decisions. We have a Medicaid waiver in that we've had in for over a year that would move our state to a managed Medicaid program, which has worked. It's better for us. It's better for those relying on Medicaid. We can afford it. So go ahead and improve our waiver. That'd be the first step. But the long term is give us more flexibility. I mean, it'd be great to get a block grant.
Flexibility to do what? To lower eligibility, to lower benefits?
To spend the money the way our families need it. I'll give you an example. There was a lady I talked to that was working full-time, and her husband was working full-time. They were having a baby, right? And so she could not stay. She didn't have enough money to buy health insurance and wasn't getting health insurance through an employer. She wanted to get some health insurance, but what she ultimately had to do is quit her job. There should have been a subsidy. The way to solve her need would have been to give her a subsidy to buy insurance, not make her quit her job so she made less money to go on Medicaid. That doesn't make any sense. So we ought to think about programs like that where we keep people employed. In our state, people, I know, and I'm sure this is true around the country, people want to work. Let's help them keep their jobs, but provide the healthcare safety net that they need.
So to be a somewhat different tack on healthcare, what is it that's prompted you to look for a way to work something out with the administration?
Well, Governor Romney did not win the election, so that was not an option to repeal Obamacare. So my goal now is focus on what's good for our citizens.
So to be clear, Governor, what are you going to say in the letter to the federal government? What is your official response going to be?
The official response is going to be, I want to sit down with you. I want to sit down. I want to figure out how we can work together to lower the cost of health care for our Floridians, make sure our Floridians have access to quality health care, make sure we have a safety net that, one, is good for our citizens that we can afford. So that's what I want to do. I want to sit down with them.
The House Speaker and the Senate President have said that you don't have the authority to move ahead on something like that because they would have to approve an exchange in the session. Do you agree with that?
Well, here's my focus. I'm sending a letter to Secretary of Civilians today, and I'm going to ask for a meeting, have good conversations about how we can work together to reduce the cost of health care, improve the access to health care, improve outcomes. That's what my focus is.
But do you agree with what those two men have to say about your authority?
I'm sending my own letter, and I know what.
So you're not rejecting the state exchange today? That letter won't do that. You're still open.
What I've said is I need more information, but I want to sit down to see if there's a way. Look, if there was a way to do an exchange that reduced the cost of health care, improved access, improved the quality of health care, I'd be interested in doing it.
You're doing your own exchange in Florida right now. Florida Health Choices. It's going to launch any week. Why is that so bad? Why is that so different than this?
Look, we have our federal, we have Obamacare. Okay, so we've got to make a decision about whether we're going to have a state or federal exchange. What I want to do is sit down and see if there's a way to do the things I want to do. I would hope that the federal government has the same goal. The problem with health care is it costs too much. I want to make sure our citizens have access to good quality health care. They have a good safety net.
Are you
on the next legislative session?